Bismillah wa salatu wassalamu ala Rasulullah. I'm Tariq Madani, Chairman of the Infection Control and Environmental Health Unit. In this session, we'll show you the personal protective equipment that we recommend to be used to protect yourself from contamination from patients under isolation precautions or for standard precautions. We have the gloves. These are the disposable gloves that we use for as barrier or as PPE, and you should not mix them with the sterile gloves. Sterile gloves come usually in packs separately, and they are sterile. But these ones are clean; they are not sterile, and these are the ones that you should use as PPE when you're, say, examining a patient under isolation precautions, under contact precautions, say, or for doing a physical examination if the patient has any fluids on his body, or to disconnect any, say, Foley's catheter from a urine bag, etc. So these are the sterile gloves. And we have the surgical mask. This is the surgical mask. And you should not mix it with the respirator. This is the respirator, or they also call it N95 mask. These are the N95 masks. These ones are used for patients under airborne precautions, whereas this one is the one that we use for as a barrier precaution for different indications. And this is the yellow gown that we also use as a barrier to protect our body from contamination. And we have also the face shield. This is the face shield that you put on your face to protect your face from splashes of fluid in patients suspected to have such an incident. There's also goggle that some people may use on the eyes to protect their eyes, along with a mask. So you can either use a mask with goggles to protect your mucous membranes, or you can just put the face shield to protect your mouth and eyes and the nose. One important thing to emphasize is that surgical masks usually have two sides: an outer side that is usually colored and an inner side that is usually white. The inner side has an absorbent material that absorbs any vapor or moisture generated from the mouth or your nose during breathing. So the colored side should be to the outside, and the white side should be to the inside. And you should never wear it the other way around. Okay? Some people have the misconception that if you want to protect yourself, you should wear it the usual way with the colored side outside. But when you want to protect others, you wear it the opposite side. And this is wrong. This is misconception. The surgical mask and any mask actually should be worn in one way. That is, the colored side is to the outside, the white side to the inside. The surgical masks come in different ties, like this one, loops like this one, or elastic bands like this one to be fixed to the head. But all of them have the same principle. Like, for example, this one, you can see that the outer side is colored and the inner side is white. So this should be kept towards the face. The inner side should be towards the face, and the color side should be to the exterior to protect yourself as well as to protect others. Thank you.